Another day, another story. Do you ever find yourself tossing and turning at night, unable to get a good night's sleep? Or perhaps you're someone who's constantly feeling tired during the day, no matter how many hours you spend in bed. Well, you're not alone. I'm Dr. Irene Y. Ansah, and I'm here to shed light on one of the most common and often misunderstood health issues of our time: sleep disorders. With several years of experience in clinical psychology and counseling, I'm excited to share my knowledge and insights to help you get the restful sleep you deserve. Sleep is not just a luxury. It's a necessity for our physical and mental health. Yet, millions of people around the world struggle with sleep disorders that disrupt their lives and well-being. In this video, we'll explore the different types of sleep disorders, their causes, symptoms, and most importantly, the effective treatments and strategies to help you get a better night's sleep. So, if you're tired of counting sheep and ready to take control of your sleep, stick around till the end of this video. Whether you're personally affected by a sleep disorder or just looking to optimize your sleep hygiene, this information can be a game changer. Before we dive in, remember to subscribe to our channel and hit that notification bell so you never miss an update. Also, if you find this video helpful, don't forget to give it a thumbs up and share it with anyone you know who could benefit from a good night's sleep. Now, let's get started. A sleep disorder, also known as a sleep disturbance or sleep condition, refers to any condition that affects the quality, timing, duration, or behavior of sleep. Sleep disorders can disrupt a person's normal sleep pattern and can lead to difficulties falling asleep, staying asleep, or experiencing restorative sleep. These disorders can negatively impact a person's overall health, well-being, and daily functioning. There are numerous types of sleep disorders, and they can be categorized into several broad categories. Insomnia. Insomnia is characterized by difficulty falling asleep, staying asleep, or both. It can be caused by stress, anxiety, depression, medications, or underlying medical conditions. Chronic insomnia can lead to fatigue, irritability, and impaired cognitive function. Sleep apnea. Sleep apnea is a condition where a person's breathing repeatedly stops and starts during sleep. The most common type is obstructive sleep apnea, which occurs when the throat muscles relax and block the airway. This can lead to loud snoring, gasping, and poor quality sleep. Sleep apnea is associated with an increased risk of heart disease and other health issues. Narcolepsy. Narcolepsy is a neurological disorder characterized by excessive daytime sleepiness and sudden, uncontrollable episodes of falling asleep during the day. It can also involve symptoms like sleep paralysis, vivid hallucinations when falling asleep or waking up, and sudden loss of muscle tone, cataplexy. Restless Legs Syndrome, RLS. RLS is a neurological disorder characterized by an uncomfortable urge to move the legs, often accompanied by tingling or creeping sensations. Symptoms typically worsen at night and can interfere with sleep. Parasomnias. Parasomnias are abnormal behaviors or experiences that occur during sleep. Examples include sleepwalking, night terrors, and sleep-related eating disorder. Circadian rhythm disorders. These disorders involve disruptions in the body's internal biological clock, leading to issues like delayed sleep phase syndrome, a tendency to fall asleep and wake up much later than desired, or shift work sleep disorder, difficulty sleeping due to working irregular hours. Hypersomnia. Hypersomnia refers to excessive daytime sleepiness even after a full night's sleep. Conditions like idiopathic hypersomnia and Klein-11 syndrome fall into this category. Sleep-related movement disorders. These disorders involve repeated, involuntary movements during sleep, such as Restless Legs Syndrome and periodic limb movement disorder. Sleep-related breathing disorders. Apart from sleep apnea, other breathing disorders like central sleep apnea and complex sleep apnea syndrome can disrupt sleep. Other sleep disorders. There are various other sleep disorders and conditions, including sleep-related eating disorder, sleep-related groaning, and exploding head syndrome. Diagnosing and treating sleep disorders often involves a thorough evaluation by a healthcare professional or sleep specialist. Treatment may include lifestyle changes, behavioral therapy, medications, or, in some cases, medical devices like continuous positive airway pressure, CPAP, machines. The goal is to improve sleep quality, address underlying causes, and alleviate the symptoms that disrupt a person's ability to get restorative sleep. Certainly, let's explore the causes, symptoms, and effective treatments and strategies for some common sleep disorders. 1. Insomnia. Causes: stress, anxiety, or depression. Poor sleep habits or irregular sleep schedule. Medical conditions or medications. Lifestyle factors like excessive caffeine or alcohol intake. Symptoms: difficulty falling asleep or staying asleep. Frequent waking during the night. Waking up too early and being unable to fall back asleep. Daytime fatigue, irritability, and difficulty concentrating. Effective treatments and strategies. Cognitive behavioral therapy for insomnia, CBTI. A structured program that helps identify and replace thoughts and behaviors that cause or worsen sleep problems. Sleep hygiene. Improving sleep habits, such as maintaining a regular sleep schedule and creating a comfortable sleep environment. Relaxation techniques. Practices like deep breathing, progressive muscle relaxation, or mindfulness meditation to reduce stress and anxiety. Limiting stimulants. Reducing caffeine and alcohol intake, especially in the hours leading up to bedtime. Prescription medications. In some cases, doctors may prescribe medications for short-term relief, but these are usually not a long-term solution. 2. Sleep apnea. Causes: relaxation of throat muscles during sleep, obstructive sleep apnea. Brain's failure to send proper signals to the muscles that control breathing, central sleep apnea. Symptoms: loud snoring. Pauses in breathing during sleep. Gasping or choking for air during sleep. Excessive daytime sleepiness. Morning headaches. Effective treatments and strategies. Continuous positive airway pressure, CPAP. A machine that delivers air pressure through a mask to keep the airway open. BIPAP, bilevel positive airway pressure. A variation of CPAP that adjusts pressure during inhalation and exhalation. Lifestyle changes. Weight loss, avoiding alcohol and sedatives, and changing sleep position. Surgery. In severe cases, surgery may be needed to remove obstructions in the airway. 3. Narcolepsy. Causes: primarily caused by a deficiency of hypocretin, a neurotransmitter in the brain. Symptoms: excessive daytime sleepiness. Sudden, uncontrollable episodes of falling asleep during the day. Sleep paralysis. Vivid hallucinations when falling asleep or waking up. Sudden loss of muscle tone, cataplexy. Effective treatments and strategies. Medications. Stimulants and medications to manage symptoms. Scheduled naps. Short, planned naps during the day to manage sleepiness. Lifestyle adjustments. Developing a structured daily routine. 4. Restless Legs Syndrome, RLS. Causes: often idiopathic, of unknown cause, but genetics, iron deficiency, and certain medical conditions can play a role. Symptoms: an irresistible urge to move the legs. Uncomfortable sensations like tingling or creeping in the legs. Symptoms often worsen at night. Effective treatments and strategies. Lifestyle changes, regular exercise, avoiding caffeine and alcohol, and warm baths before bedtime. Iron supplements, if iron deficiency is detected. Medications, dopamine agonists and other medications to relieve symptoms. These are just brief overviews, and individual experiences with sleep disorders can vary. Effective treatment often involves a combination of approaches and should be tailored to the individual's specific condition and needs. If you suspect you have a sleep disorder, it's essential to consult a healthcare professional or a sleep specialist for proper diagnosis and treatment. Additionally, adopting good sleep practices can benefit anyone looking to improve their sleep quality. In the next video, we'll delve into the 4 major sleep disorders: sleep apnea, insomnia, narcolepsy, and restless legs syndrome. You'll learn what each of these disorders is, what causes them, the common symptoms to watch out for, and most importantly, practical tips and treatments to improve your sleep quality. So, if you're tired of counting sheep and ready to take control of your sleep, stick around till the end of this video. Whether you're personally affected by a sleep disorder or just looking to optimize your sleep hygiene, this information can be a game changer. Please remember to subscribe to our channel and hit that notification bell so you never miss an update. Also, if you find this video helpful, don't forget to give it a thumbs up and share it with anyone you know who could benefit from a good night's sleep. Thank you and see you in the next video. Thanks for watching.